As patients hang in limbo wondering what to do next, the UPMC Highmark divorce is heading for the final breakup. But the Pennsylvania Attorney General has filed suit against UPMC to try to prevent that breakup. Now UPMC is firing back. John Chumway is live now with some new developments in the story. John?
Yeah, and Stacey, UPMC is basically saying that Attorney General Josh Shapiro is biased towards Highmark. And they say he's acting and coercing an agreement that he has no authority to do. When it comes to needing health care, we all want the reassurance that what we need will be accessible when we need it, where we need it. But for many, there is a fear of the unknown as the UPMC Highmark split nears on June the 30th. The Attorney General wants the medical giants to continue their consent decree. Highmark has agreed. Shapiro is suing to force UPMC to continue the relationship, as he said in early February.
UPMC must behave in a manner consistent with its charitable mission in all facets of its operation.
UPMC in its court filing this week says the AG is out of his lane and using coercion. Quote, "The Supreme Court held in no uncertain terms that the consent decree's termination date, including Medicare Advantage, was an unambiguous and material term," end quote. And the UPMC filing goes on to say that the Attorney General is operating in Highmark's interest, not the public interest. But the pressure on UPMC is not just coming from the Attorney General. The president of the Hillman Foundation, David Roger, weighed in with the Post-Gazette in an op-ed piece today. Henry and Elsie Hillman, over their years, donated $77 million across the UPMC system and provided the $10 million lead gift to build the Hillman Cancer Center. Rogers says, quote, "They'd be disappointed, very disappointed, to know it might not be accessible to anybody who needed it." And he went on to say, "This concerns us. Everyone is concerned. If you have the wrong insurance, you can't go." If you would ask Elsie, she would say people should have access. All people, even if it has to be provided for free, end quote. Now, the Attorney General's office this afternoon issued a statement responding in part to what UPMC. They didn't want to get into a media back and forth, but they did say that UPMC is the only entity interested in winding down the relationship with Highmark, and said, quote, "The only coercion going on here is UPMC's attempt to coerce Pennsylvania consumers to pay a lot more money," end quote from the Attorney General, Stacey.
All right, John, also this question. As this plays out in court, what are the subscribers, the patients of UPMC and Highmark supposed to do?
Well, we're looking at that June 30th deadline, and right now there's no indication this agreement is going to continue past then. So patients shouldn't sit around hoping that there's going to be a resolution to this. They need to be talking to their doctors and looking to their medical care and what they're going to do if indeed the consent decree ends the relationship on June the 30th.